Good afternoon. Thank you very much for all the questions which came to me after the last informative film about the question in general. When does it make sense to save teeth? When should teeth be extracted and so on? And I picked a typical case from our clinic, and I would like to show you what can be done on the teeth and what can be done with implants. This is the panoramic overview picture of a typical case as we see it every day. So there are, of course, some teeth here, like these front teeth, which have to be extracted. Also, this molar is destroyed. It needs to be taken out. We have gaps. So this patient needs quite a bit of reconstruction in the upper jaw. The question is, should this be done on the teeth, or are these teeth going to be extracted? In any case, you see up here also the wisdom tooth has to be removed. Well, to make it short, this patient decided for full extraction in the upper jaw, but I want to show you what are the alternatives in his case. So on teeth, we could have been doing a treatment attempt, let's say, by extracting those teeth which clearly have to go out, like this one, this, maybe even to take the wisdom tooth out, and then to install a circular bridge on teeth. This would last approximately between 5 and 8 years. The costs, if it would be done in Germany, are around 9,000 euros. And you see that there are also considerable costs for the dental laboratory. In Switzerland, it's around 10,000 Swiss francs. And also here, the laboratory costs are high. So with this type of bridge on teeth, a circular bridge on teeth, we could meet the patient's expectation. Of course, the patient wishes to have fixed teeth. Now, after a few years, after let's say 5 to 8 years, a second treatment attempt would be necessary because a number of teeth would fail by then. And in this situation, we would have approximately 4 to 5 teeth left, and the rest of the teeth are then out. And of course, we cannot place a fixed bridge with so few teeth. So for the second treatment attempt, we would incorporate a removable denture, for example, fixed on 4 to 5 telescopes. And the costs are listed up here. It's about 14,000 euros with 8,000 euros lab costs, or 18,000 Swiss francs with 10,000 Swiss francs lab costs. After another 5 to 8 years, all teeth have to be removed, and then, according to the concept of traditional implantology, the patient would receive dental implants after bone augmentation. This is actually not calculated because bone augmentation is creating a lot of costs. And in the end, let's say after 1.5 years, a fixed bridge would be incorporated again. Now, the costs for this can only be estimated. In Germany, 16,000 euros. In Switzerland, about 20,000 Swiss francs for this third treatment attempt. Keep in mind that this will be done after 10 to 15 years after the first treatment. Now, if you count together all those 3 treatments, which are necessary until finally the teeth are out and implants are incorporated, in Germany the costs would be around 38,000. In Switzerland, the costs would be almost 50,000 Swiss francs. Now, in Germany and in some other countries, we do have a national health insurance which covers a part of these costs. But for example, in Switzerland, all this has to be paid by the patients. I mean, out of their own pocket. There is no refunding from nowhere, maybe a little bit refunding from the taxes, from the income taxes of the patients. Now, of course, patients in Switzerland, if they look at these figures, in those 3 treatments, they tend to extract teeth, and they tend to extract teeth early because it is not affordable. Now compare this to the strategic implant restoration which we do in the Simpladent clinics. In the upper jaw, 11 implants were placed plus a fixed bridge. This would cost between 9,000 euros and 12,000 Swiss francs. Then after about 5 to 8 years, we would exchange the bridge on the same implants. So there are costs of 2,500 euros, 3,500 Swiss franc approximately. The third bridge after again 5 to 8 years. And if you count this all together, treatment costs are less than 14,000 euros, or here less than 20,000 Swiss francs. So these are the total costs for all 3 restorations and those implants. Now let me go back a little bit. You have to compare those costs to those costs. So here, instead of 38,000, it would cost only 14,000, and in Switzerland, instead of almost 50,000, the cost for the treatment would be around 19,000 or less than 20,000 Swiss francs. These are the total costs in around 18 to 20 years. Now, of course, more and more patients decide in this situation not to save their teeth, actually not to go to the dentist, because dentists are typically educated from their university background to save teeth, to work on teeth. Like the name says, they are the doctors for the teeth, dentists, and many of them are simply not educated as implantologists. They don't even know typically the possibilities of dental implantology today, and therefore they tend to keep teeth in the mouth very, very long, in my view, too long. Now, of course, there are also patients who simply like to keep their teeth. They don't want to extract their teeth, and this is, of course, something that has to be respected. I think nobody has a problem with that, but considering the costs, considering all the treatment efforts, all the appointments and so on, today more and more patients are very happy to get rid of their teeth and to get a fixed restoration in a very short time. And this is exactly what we can offer with the Simpladent concept. Thanks again for your questions and enjoy your day.